speaker to us.
God bless you so much. Once again, I welcome you all this evening. It is in the plans of God that we'll meet tonight. So It is a blessing. It's one of God's blessings for us. And the word of God says that above all, we should be in good health and prosper. As our soul prospers, it is the intentions of God for us to be healthy so that we can be happy and fulfill life here and thereafter. And I know tonight is another time that God is blessing us through teachings as well. Amen.
Amen.
We are so blessed.
Amen.
That's why the pandemic, God has been gracious unto us. From last year to this year, God has been so wonderful to us. And tonight testify God's love. And we are so privileged to have in our midst our own father, who is our own, I would say, and it's also from South London District. He's also worshiping with Trinity Congregation. He's also a presbyter, in fact, a senior presbyter. He's also a wonderful father as well. Papa is married. Papa is so blessed with children. I'm one of them, ministers in the family, and Papa with grandchildren. So Papa is blessed, and tonight he's going to share his blessing through his experience. We are in the midst of COVID-19, and there's so a lot of confusion here and there. We've been hearing all over outside UK, from Ghana, from other parts of the world about this pandemic, which is putting fear, and even including we Christians. So tonight, God is opening our eyes through these teachings so that we can stand firm and hold on to our faith in Him, so that our faith in Him will know that He is with us. We are honored to have Dr. Emmanuel Akuffo in our midst. And with the rest of Papa, I'll leave up to Papa to tell us, because Papa, I don't want to make a mistake. So Papa, you meet God's children all over Midlands, and we have other brothers and sisters joining us for this program. So Papa Emmanuel Akuffo, with an amen as a welcome. Can we shout amen to welcome Papa on the platform? Can you all shout amen?
Amen.
Amen.
Amen. Amen.
Amen.
And thank you very, very, very much. Thank you, Reverend Gifty. I always call you Reverend Gifty because it's nice, to have such a person with deep-seated convictions in the Bible leading a church. And it makes me so proud to see that there are people like Osofo Gifty in our midst and in charge of a congregation where we can always get together, be happy, and think of topics like COVID-19. I'd like to give you a little bit of my background so that you know where I am. I have specialized in two areas. My first specialty was in community medicine and child health, which I studied at a postgraduate level in New Zealand. And when I came to this country, my job was a school medical officer for Enfield and Haringey, North London. And my role was to give immunizations to children and also assess children for preschool, so that if you had special needs or something, or you hadn't vaccinated, we'll make sure that I gave you the vaccination before we signed your papers for you to go to school. So that is my first background. Now, later on, I became a psychiatrist, and as some of you may know, I'm now a consultant psychiatrist. But my first specialty was in community medicine. And therefore, immunization is a specialty that I'm very fond of. Now, it's important that at this stage, we can get together as Christians ourselves to look at our families, to look at the people around us, to look at our congregation, and to remember our relatives, our families in Ghana. Now, the important thing as part of introduction for COVID-19 is that it is what we call a communicable disease in that a communicable disease is something which you can pass on from one human being to the other. Now, COVID-19 is caused by a virus, and I'm sure a lot of you know the difference between bacteria. At school, we're learning about bacteria, we're learning about viruses. Yeah. The difference is that with bacteria, it's very much easier to treat because we have antibiotics. And with bacteria, you can isolate them in the lab and find the appropriate antibiotic to treat it. It is not the same as a virus. A virus is not like that because it varies in its shape and it doesn't have a constant shape. It can also change by mutation, but it can change when it comes to question and answers. I will explain all those. And therefore, we started with COVID-19, but all of a sudden you've heard of variants, Brazilian variants, you've heard of a South African one, some coming out of different places and so on and so on. This is the nature of the virus, and that's why a virus is so tricky and rather difficult to treat. So it is important that we unlike bacteria, as I've said, where you have antibiotics to treat specific bacteria, this is not at all like that. And we wish we had something which we would just use to treat it, and then we will all be free. So the idea of a vaccine is the idea of an active immunization is to prevent, please. Number one is to prevent the disease caused by the virus. That is the first thing. The second thing is to make sure, and as you all know, this is a virus that is spread by what we call droplet communication. So in a droplet is a tiny drop which can come out of your nose when you sneeze, or when you cough, or when you talk to somebody face to face. There are tiny drops called droplets which you pass on to the person. And if you are carrying infection, which is a communicable disease, then that infection will go to that person. This is why we are being told to wear masks. Now, the reason why we ask to wash our hands, keep the distance, wipe surfaces which may be contaminated, is that droplets can rest on surfaces. And this is where a lot of people don't realize. So somebody may have used the place where you are now sitting and may have coughed, sneezed, wiped his nose or mouth and put it on the seat. And you may not be aware. And then you go and sit, touch the same thing, rub your face, and then you can be a victim of that virus. So that is very important that we know. Now, what does a vaccine do? When you get a vaccine, what it does is that it triggers the body's natural production of the kind of what we call antibodies. Because you see, if you, let's say you cut yourself and it gets infected, when we see this all the time, it heals. Why? It heals because the body has its own defense mechanisms to tackle that wound that may be infected or any infection, about mild infection that comes. But depending on the amount of what you've obtained into that wound or into the body, you could be overwhelmed. So your own defenses will not be sufficient to fight that infection. And this is why we give you the vaccine to boost or trigger your own defenses. The immune system pushes out those defenses to fight the disease. And this is where we got the word immunization. Immunization is from the immune system, your own body defenses to fight infections that come to us. So why are we so worried at the moment? We are worried because this is quite a dangerous virus, in that if your body is overwhelmed with the virus, and once it gets into you, gets near, it doubles very, very quickly. It affects your breathing. It goes down your windpipe, and it goes into your lungs, and it goes into your lungs, and it goes into the tiny tubes which go into various parts of the called bronchioles, and it goes in there. And once it gets in there, it causes inflammation. And with inflammation or with any kind of virus, you can also get secondary bacterial infection, which is why it is dangerous. So that when your lungs are clogged up, what happens? You can't get the oxygen that you need. And this is why when people are ill, you find they go into hospital, and then they have to do, among other things, give them oxygen. Make sure that the body oxygen index is at the right place. Otherwise, you succumb. And through that, if you are not lucky, then it means you are going to be very ill, needing intensive care treatment. And then, depending on your own pre-infection physical health, you may or may not succumb to it. And this is why people who have conditions like diabetes, hypertension, people who are suffering from chronic diseases, heart and other things, we say that these are priority groups in addition to old age to be given the vaccine first. And this is what has happened. This is why the vaccine has been given to these priority groups. So at the moment, we've come down to about 60 and above, and it's hoped that very soon, from May 1st, they're saying anybody who wants the vaccine may get it. Now, so why do we have to give it twice? And I always tell people, you remember the measles vaccine, for example, the first shot doesn't give you that absolute protection. It gives you a percent to 70 or so. Now we are hearing that even one shot can give you a little more than 70%. But the idea is that the first shot alone wouldn't give you absolute protection. So the idea is to give you a second one to boost yet your immune system greatly, so that even if you come in contact with the disease, you have enough immunity to fight off the disease. And even if you get it, it will be so mild that it won't affect you to the same extent that somebody who hasn't had the vaccine when they are subjected to this. And it's important to know this, please. the fact that you have had the vaccine doesn't mean you say, all right, I've had the vaccine, therefore that's it. I throw away my mask. I wouldn't bother about this social distancing, or I wouldn't wash my hands or anything like that, because it is always possible, depending on your immune system and how much immunity you gathered from the vaccine. And we are human beings. We vary from one human being to the other. You could get something. This is why we are saying, unless when they talk of herd immunity, what they mean is that enough people in the population have acquired sufficient immunity through vaccination that the chances of the disease spreading be lowest. Now, what is a pandemic? It's a pandemic because it's gone everywhere in the world. When we talk of epidemic can happen. Epidemic is when it's confined to certain regions or countries or areas of the world. But we are now in a pandemic, and we have to take all the precautions to make sure that we can save enough lives and cut down on deaths. Can you believe that UK, one of the best countries for health service? And if you imagine that we are now about 125,000 people who have died, this is very, very, very serious. America is now 532,000 people who have died from this virus. More than all the American soldiers who died in the First, Second World Wars, Vietnam and Korean Wars, and all these. So it is terrible. It's frightening. We don't want to expose ourselves and not be vaccinated. And please get the same message to people in Ghana who are having their doubts, because we only have 600,000 vaccines in Ghana now. And sooner or later, as you know, there is a possibility that it may run out. And then when it runs out, you know what happens in Ghana. Some may get into some pockets, and then you may have to pay before you even get it. And so please encourage everybody. We try to encourage everybody to get vaccinated. When it comes to your turn and you are invited, please don't hesitate. Go and get vaccinated. Now, what sort of warnings or precautions do we take against this vaccine? The first one is when you go for the injection, even when your GP who knows all the history about yourself calls you, we still have to ask certain questions. One, do you have a severe allergy to anything? And when we say that, the reason is that there are some people who are so severely allergic to certain drugs or vaccines. It can be anything. And I know people who have died just because, not because of the vaccine, but it's a reaction that the least thing, you may have heard of people who are even allergic to peanuts, or even they eat pineapple or a particular fruit or something, or they take a particular medication and get a severe reaction. So if you have that kind of severe reaction, then we are not going to give you the vaccine. We will ask more questions. We will check and make sure that certain tests are run, and if it is safe, before you can have it. But people with very severe reaction, allergies to medication or other things, they are the number one people that we try to avoid not to give. Now, in this country, and I must stress in this country, now some pregnant women in America have been vaccinated, but in this country, what we say is that if you are pregnant or anticipating pregnancy within the next 2 months, then we are not going to give you the vaccine. The reason is that the vaccine has not yet been tried in babies or young children. And at the moment, it's 16 and above. And whereas, 16 and above. So you should be, some people are it's actually 18, but we advise 16 and above. The Moderna vaccine was the only one who wanted 18 and above, but I think now it's recognized that 16 and above can receive it. So first, you should be 16 and above. And the reason is that because they didn't do any trials in children. And that is the only reason. But with time, there will be more trials in children, and then we'll be able to vaccinate school children and everybody, which is the normal thing for vaccination. The second thing that so I've talked about allergy, and in this country we will ask about your status with regards to pregnancy. It's very important to us. Now, if you've also had a problem with any type of vaccine in the past, then we have to be very cautious. We have to run some tests. We have to get more information from your GP before you can have the vaccine. Also, if you have a severe, at the time you go for the vaccine, if you have any severe illness with high temperature, we will rather you don't get the vaccine until you feel better. Then you can rebook and we'll give you, because we don't know what that particular high temperature is. And it could be the beginning of some other illness, which could be made worse if you get the vaccine. Also, if you are taking certain types of medication which weakens your immune system, and it's the GP who will know that. So they will ask you, are you taking any particular medication which can weaken your immune system? You have to let the nurse or the doctor giving the vaccine know about that. And then they will say, okay, we will need more information or run some tests before we can give you the vaccine. And there are certain conditions, where, for example, if you've had HIV/AIDS, it's a condition where it attacks your immune system so badly. And sometimes the reason why we hesitate is that maybe when you are given the shot, your body may not trigger the immune system that we felt it could do. So again, let them know if you have had HIV infection and you've had AIDS before, please let them know, because it's in your own interest. The other thing is people who have bleeding disorders. And when we talk of bleeding disorders, you may have heard about, hemophilia and other things, where any kind of puncture to the body, you can have a lot of bleeding, and we don't want that, or we should know the precautions to take. It's not a contraindication as such, but it's something that we should be told before we get it. Now, the other thing is, if you are taking any other medication, when you go, please let the nurse or the doctor know, because as you know, there are certain drugs which may interact with the vaccine, and we don't want that. So for your own safety, please tell them that I am on this medication, and then they may check with your GP, and if it's going to interact with the vaccine in any way, we are not going to give you that vaccine. driving when handling machines after you've had the vaccine, normally what we do is after the vaccine, the ideal thing is you sit down for about 15 minutes before you drive or something. Unfortunately, it's not always possible for that because I've seen in some parts of America, it's a drive-through, so you can get it, and drive through. But I think what they've done is when you take the vaccine, you can park. There's always a car park there. Wait for a little while so that if there is going to be any reaction, we will know straight away, and then there will be medical help straight away. So please, you take it, ideally rest for about 15 minutes, and then you can drive, or if you are going to handle machine or anything. Yeah. So having said all that, I have to be very open with you. There is no, and I will say this again, there is no medication or vaccine or something which does not have side effects. I have to be very open, and we all know that. Even sometimes, if you eat certain things, you can get some side effects. And as I say, I've already said, you can get some allergies. So which are the ones that we need to pay attention to? And I must say, if I go through a list, it doesn't mean you are going to get it. I took mine on the 23rd of January. I did not have anything at all. I drove home. In fact, I didn't wait for the full 15 minutes because my wife was waiting for us to go. I went home. It didn't cause me any side effects. My wife also took it. She had a little bit of headache, but it wore off very quickly. And we always say, if you get headache or you feel a little bit unwell or your muscle pain, please take paracetamol, 2 tablets, and you'll find that quite often it goes away. And paracetamol, you can repeat it every 4 hours and you should be all right. So what are some of the side effects that are very common and which we need to go through? Because the usual side effects, the very common ones that you may experience because it doesn't mean everybody will have it. Pain at the site, after that is common. When you get an injection, because it's a deep intramuscular, it goes into your muscles, so you get a little bit of pain. I mean, the prick is common. It's just because the needle is entering your skin, you will feel the prick. But because it's a deep injection, it goes straight into the muscle, and then it stays there for a while. So you get a little bit of a bump or a little bit of pain there. It doesn't last. It goes away. You don't even have to think of it, and it goes away. Sometimes you may feel tired after taking the vaccine. So this is why we make provision that when you take it, the first 15 minutes at least, have a little rest if it's possible, yeah? But if you go home, because of this, and tiredness can happen, be in bed. It's only temporary. This is temporary, and then it goes away. It goes away. Headache, some people have headache, and I've already said that you can take paracetamol, 2 tablets. If it doesn't go away, after 4 hours or so, you can take another 2, and you'll find that it will go away. So it's not something which should stop anybody from having the vaccine. Muscle pain, I've talked about. Some people have talked about a bit of feeling chilly, as if a little bit feverish, but it doesn't last. These are temporary reactions to anything. It can be injection for something, it can be medication, it can be eating some nuts or something, but it goes away within a short time. Joint pain and fever have been reported. So these are common things which can happen. But as I say, take some paracetamol and you repeat it after about 4 hours if you are still feeling that way, and you'll be better. There are some people who don't have any reaction. I mean, I took it on the 23rd of January, and I am an example. I did not have any side effects at all. I didn't have any side effects at all, but we want you to know. So I've mentioned the very common ones. Then occasionally, we've had some swelling at the site of the vaccine, but as I say, it will settle. And maybe some redness at the site. It doesn't show so much in our skin, but with especially with white people or people who are light-skinned, they may show a little bit of redness there. And we have to tell you to let you know. Occasionally, some people have talked about nausea as if they are feeling sick. But as I say, these things don't last. And if you think of the benefits of the vaccine, these minor ailments should not put you off because because they will go away within a short time. Very, very, very occasionally, I mean, people may feel unwell for a while, a day or two, and I think I've come across people who have told me, "Oh, look, when I took it, I was unwell for a day or two." But then, when they got better, they didn't even realize it because these are temporary things which will pass without much problem. Some people, very uncommon, because something has gone into your system. Some people, very, very rarely, maybe a lymph node swell up in the armpit or something like that. But as I say, it's very rare and it goes away very, very quickly. So when you have side effects, we encourage that you phone the center where you had the vaccine and let them know. You phone your GP and let the GP know. It's just so that we gather enough information about what the vaccine does to certain people. But as I say, so far, if you imagine that millions of people have had the vaccine in America, across Europe, in South Africa, Australia, New Zealand, and in Ghana, we've started. And I must say that I've been keeping some contact with friends in Ghana to find out whether anybody has reported any serious side effects and so on and so forth. And you'll be surprised, the Ghanaians are taking it very well. Apparently, there is much easier. You go with your ID to a center, Adenta or Kaneshi or one of these places or polytechnics where you show your ID. Once they see that you are 60 and above, you get the shot and you go. So they are doing very well. And as I say, they have the AstraZeneca, they took 600,000 initial batch, which is very, very good. Maybe with the African countries, apart from South Africa, we have done well about the first, and that's not a bad thing at all. So we must be proud of our own country and what we've done. I don't want to talk too much because I want to leave you so that we can have interaction, we can have questions, we can have discussions, and then I'll do my best to answer some of those questions raised in videos and other things, which are trying to put people off. And I must say that some of them are quite not true, or not based on facts. So I think, Reverend, I will just pause here and let people ask questions so that we can have an interactive kind of session. I think that will be better. Yeah. Yeah, so I will leave the floor to you and the Zoom to you for people to ask me questions.
Antinokas, please take over since Papa.
Oh, you can.
Doctor want to write for questions, so please.
Right. Can I say, you can speak, if you are more comfortable in Twi, you can ask your question in Twi. If you are more comfortable in the English, you can ask in English. Yeah.
You can ask in Ga if you want to as well, please.
I'm not very fluent in Ga, but unless...
Papa, I will do that for you. We do interpret it, so
okay,
you are
thank
safe.
you. All right then.
Okay,
thank
so
you.
Doctor, please sit with the questions and take over, please.
Yeah.
Please, if you go to the raise your hand on the more, and I will call you. And you can also type in your questions and I will read it out.
Okay.
Sorry, I have a question.
Yes.
I had my vaccination, right?
Yeah.
And they told me that, because I didn't understand it very well, before having it, the gentleman told me that if I take the vaccination, I have to wait before I plan to have a child. So I wanted to know if it affected, like, it will affect it maybe in 1 or 2, 3 years time. Will I have any effect of the baby or something like that? I just want, because some people are afraid to do it because maybe they think that they can't conceive anymore.
Yeah.
Okay. So if you can please clarify this thing for me.
Right. Very good question. I said that in this country, for example, if you are anticipating to get pregnant within the next 2 months, we will not give it to you. We will prefer that you wait, or if you are pregnant, we will prefer that you have the baby first. Now, the only reason why that is because the trials did not include children. Yeah. And that is the only reason. We are not saying, in fact, in America, I think they've got nearly 3,000 to 4,000 people who have taken the vaccine and realized that they are pregnant. So far, we haven't had any reports of miscarriage because of the vaccine, when they didn't know they were going to get pregnant. Also, Pfizer has started and Moderna have started giving the vaccine to some pregnant women. And so far, we haven't had any adverse reaction as such. But as to the vaccine affecting your fertility in the future, there is no evidence that if you take the vaccine, maybe 2, 3 years time, you won't be able to have a baby, or if you have a baby, then something will happen to the baby. There is no scientific evidence in terms of research to say so. Yeah. Are you happy with that, or do you want me to say further? Or? Hello?
Thank you.
Okay.
Okay.
Papa, my question is,
Yeah.
Can the COVID disease spread through food?
In the sense that, yes. And the reason why I'm saying this is that it can spread anything. It's a droplet infection. Yeah, it's a droplet infection. So you'll find that in the shops and everywhere, health and safety is being taken at the highest level. The reason is, it's if supposing I'm infected, let's say I'm infected, and I bite a piece of bread and give it to you to eat it as well. You understand? When my saliva is also there, it maybe has affected the bread, then it is possible. Because you see, droplet infections are very, very tricky. When I sneeze or I cough or I talk to maybe with a lot of particles coming from my mouth, they land on the surface. And when they land on the surface, they can stay there for up to 48 hours. You understand? So that is where, and it depends on the type of food. It depends on the type of food, yeah? If it's maybe a sandwich that is open there, people have maybe droplets have gone on it or something like that, then it means you are running the risk, because it's not going into your mouth that matters. You touch it, you rub your nose, you touch your face, and that is how, because these are very, very tiny organisms. So we take maximum precaution. And you'll find why are restaurants closed? I mean, you go in there, you eat, you talk, you are happy, you are passing it over the food, tea, and this is why they've taken all the maximum precautions. So that chance is very, very, very small, but we, even as small as it is, we want to recognize that if in a COVID time, you are not going to take food, bite it, or give it to another person. Or in Ghana, say if they are eating fufu together, we don't want that. People all eating with the same saliva and everything, going in, talking close, and so on and so forth. So it is a very remote possibility, but that possibility is there. And this is why the answer cannot be no, because it can happen technically.
Okay.
But I still have a follow-up.
Yes, please.
Can the virus sustain in hot weather?
Yes.
Hot environment?
Yes. And this is why, when it came at first, you see, we've been very lucky in the tropics and in Africa that our numbers have not been as high as in Europe. And it is possible that in our situation, I mean, now that there is air travel and people crossing borders and so on and so forth, I mean, this is how the virus spread quickly, because the assumption is that it may have started in some part of China. It may have started, but then it was spreading, and then air travel, movements, people, things being exported here and there, human beings being on ships or in trains and planes and everywhere, it was spreading. But the tropics, we've been lucky. So it's possible that the nature of this virus is such that it's not multiplying, or it's not doing what it's doing in temperate countries like here, America, Europe, Russia, and so on and so forth. But there are cases in Ghana. There are a lot of cases in South Africa. South Africa, of course, has a bit of, you see, below the Limpopo River towards the south, you find that they can have very low temperatures. You know that in South Africa, they can have very low temperatures. Snow is very rare, but it has happened before, you know. And maybe this particular virus, I cannot say for 100%, but it's not maybe surviving as much as it would in its country, but it occurs in both areas, please. Yeah.
Can we get question from Ohima Kusia?
Yeah. Okay.
Thank you, Mama Dorcas. Papa, my question is, I did an antibody test, and then it was showing that I've got it before, but my system was able to fight it.
Yes.
So it means I don't need the vaccine because my system can fight it, or do I need it? Because recently, I think last week or two, the NHS donors, they just called me that because I did the antibody test and it was showing that my system was able to fight. They even needed some blood sample because they want to do some research on it. So it means I don't need a vaccine, or I need a vaccine because the vaccine is just giving you the
it's boosting
it's
your
just boosting
immune
your
system.
Immune system.
It's boosting your immune. Now, let me tell you, let me give you an example. Take the flu vaccine. Take flu, for example. You know, why do we say every year we go for the flu vaccine? We don't know all the characteristics of this particular vaccine. We don't know. And why it's killing so many people. We don't know for sure. Now, I'll give you an example. If you take, for example, let's say chickenpox and shingles, you'll find that it's the same virus. It's the same, exactly the same virus that causes chickenpox, that causes shingles. And we tend to say, oh, for chickenpox, if you've had it once, it's not likely that you have it again. It's very rare, very, very rare for you to have chickenpox and have full chickenpox again. But you can have shingles later on in life, and it's the same type of virus. The reason why people who have had it, because a lot of people may be carrying it, but because it's so mild, they are not showing symptoms. You understand? And this is the thing. You have built up some immunity when you've had it, but it cannot give you 100% immunity against the virus. And this is why even when you've had one shot of vaccine, you are having the second one. Well, we are being told that the Johnson & Johnson vaccine may require only one. Don't forget that all the approvals being given to the vaccine, if you go and have a vaccination, they give you a leaflet. If you look at that leaflet, they will tell you that this, I've got one of those leaflets, I put it somewhere. And it says, this medicine does not have a UK marketing authorization, but has been given authorization for temporary supply by the UK Department of Health and Social Care and the Medicines and Healthcare Products Regulatory Agency for active immunization to prevent COVID-19 disease caused by, the virus. The SARS-CoV-2 is the same in individuals aged 16 or age. And now let me explain. Normally, for a vaccine to come onto the market, it takes a long time. It takes trials. We do guinea pigs, or we do some animals, and then we do samples of adults and children, babies, everything before a vaccine comes out. That is why it takes so long for a vaccine to come onto the market. It is because of the standards required. This virus had to be stopped quickly because it's a pandemic. It's gone across the whole world and it's killing people very, very fast, especially those with pre-existing conditions or the elderly and others in homes were dying at such a rate that we just couldn't sit down and do nothing. So once they knew the vaccine worked, instead of waiting for so many years to have it in a large number of trials and so on and so forth, they knew it worked, and they are taking sufficient precautions to make sure that it is safe to give it. That is why the licensing came. Well, that's why they give them the authorization. And you find that everywhere, America, here, Germany, what they've said is emergency authorization. Emergency authorization. Yeah. So as I say, that is what it is. The fact that you've had it before doesn't mean you have 100% protection, because it is your own body's reaction which fought the virus and gave you that immunity. Yeah. So that's what I will say about it. But if you go for the vaccine, we ask you, have you been diagnosed that you've had full-blown COVID-19 infection? Yeah. And as I say, time will tell. Time will tell. Because ideally, if you had a full-blown one, you don't need it. Like Trump had it. Trump, and when we all thought he didn't have the vaccine, he went and had the vaccine. Yeah, so that's what I will say.
The other question, can I add it?
Yeah, yes, please.
I have about 3 questions, if I
Yeah.
can just put everything on.
Okay, go
on. They are saying that if you are pregnant, you can't have the vaccine.
Mm-hmm.
So if you can't have it, can your partner or your husband have the vaccine? That
Yes.
is one.
Mm-hmm. Yeah. Mm-hmm. They go on.
And
yes.
then 2, every year I have the flu vaccine and everything. I don't sign consent form, but this one, they want you to sign consent form. So if something happens, you can't take them on. That's the second one. If the vaccine is just for the boosting of immune system, why are they just based on the vaccine and they're not doing other things that can boost your immune system? That's the third question, Papa.
Right.
Thank you.
Okay. So the first one is that if you are pregnant, you are carrying a baby, I mean, it's you carrying the baby, yeah, carrying the baby, and your body, and it's not your husband, yeah. So that your husband is not affected in that way. Now, the reason why we are cautious about pregnancy, as I say, when we go, we'll ask you, are you anticipating to be pregnant within the next 2 months? And if you turn up, and also if you turn up with the belly of pregnancy, they will not give you. They will advise that, oh, what stage of pregnancy? Are you in the first trimester, second trimester, third trimester? Where we'll ask certain questions, but it's in the UK, we are not advising that you have it until the pregnancy is over. The reason is, this is a virus which has been studied, but we cannot say it's been studied 100% to a point where we can say it will never pass through the placenta or pass through the barrier to reach the unborn child. Or if you are breastfeeding, people have anecdotally, they've said, oh, it won't affect the baby, but we haven't tried it. And there is no full scientific study to say that. And for us to make a clear scientific statement, we should have the numbers. You see, you can't say anecdotally, oh, this pregnant woman had it and nothing happened, therefore nothing is going to happen. We don't do it like that. For scientific proof, you need a large sample, a large number of people, and then you can make that statement. And we don't want to put anybody at risk. That is why we are saying, if you are pregnant, we would rather, when the pregnancy is over, you take it, because we don't know the effect of the vaccine on an unborn child. We don't know. We don't know the nature of, But your husband, no, your husband won't be affected. The third one was, what was the third one again?
The second one, it was, we have other vaccines, but we don't sign any consent for.
Oh, the consent, yeah. Now,
like this one. So if something happens, it means you give them the right to give it to you. You can't take them on.
Yes. What happens is that, as I said, the authorization, this is like emergency situation. We are in a pandemic. This virus is killing a lot of people. A vaccine has been found to be effective against the virus. We are giving it. It is what emergency authorization. So it's temporary or emergency authorization to stop the spread of the virus. So you will sign a consent form, and before you sign, we will ask you all those questions. You understand? Are you pregnant? Are you anticipating pregnancy? Do you have any high temperature? Do you have any severe condition? Or are you allergic to vaccines or allergic to injections or medications? Are you taking certain types of medication? Do you have any blood thinning? Are you on any blood thinning drugs or things like that? Are you hypertensive? Do you have diabetes? We ask all those questions. What sort of medication are you taking? And we do that just to be 100% sure, because this is, if you like, an emergency, but a proven effective vaccine. Unlike the type of vaccines which have been approved through WHO, after so hundreds of thousands of people have received it in trials and so on and so forth. This is not the case, but we know it's safe and people have taken it, and it's now proving to be very effective. It's stopping hospital admissions, it's stopping severe cases happening. And when people even are showing symptoms, they take it, they can take it, and then they will not be as seriously ill as otherwise they would have if they hadn't taken any vaccine. Yeah. So that is the reason why you signed the consent. So we've explained it all to you. Give us your consent and take the vaccine. Is it a bit?
But because Papa, they have all your medical history with your GP.
They do, yes.
So they know everything. So why do I have to sign? So because this thing is still on trial. So they have to take off the consent form. So if I take it and something happens, then I can take you on.
Right.
And then the pregnant woman, if your husband have it, and then you have an affair, you mix with the blood, it's in his system, so it will come to your system. So if pregnant woman cannot have it, then the partner too, you can have it.
Well, as I say, this is a droplet infection. It's spread by droplet, so if the reason is it's very rare for you to have it in the same bed as your husband and then your husband not having any at all. It may be, and it has happened, where a wife has tested positive and husband negative and vice versa. It has happened. But, and there are a lot of people, you see, the reason why the vaccine is important is there are people walking around who have, who don't show any symptoms. This is the thing, who don't show any symptoms. And because they don't show any symptoms, they can easily infect you, especially if you are vulnerable. Yeah, but they will walk around like, school children and others. Now, we've reopened the schools, but don't forget, they are being tested about twice a week. Teachers are being tested. All the people working in schools are being tested. The children were tested before they started. And every week, there is testing going on. So if more than a certain number test positive, you find the class will be closed again. The school will be closed again. And we're taking maximum precautions. But as far as the consent is concerned, it is necessary for what I've said, that it is not one of these conventional vaccines which have gone through hundreds of thousands of trials through maybe guinea pigs or mice or rabbits, and then gradually through different age groups of human beings before becoming a vaccine. This is an emergency situation which needs authorization so that we can stop a deadly vaccine. That is the situation. Yeah. So unfortunately, once you sign the consent, it means you are taking it at your own risk. And we've explained it to you. We've asked you the necessary questions, and you cannot sue the government. You cannot sue the government unless there is some particular negligence not related to the way or the format by which you took the vaccine. Then that is different. Yeah.
Papa, I left you the last question. You didn't answer that one for me.
Remind me.
The last question was if the vaccine is just boosting your immune system, then
yeah.
They have other things that you can do to boost your immune system.
Mm-hmm.
So why are they just only the vaccine, but not the other ones? Because
right.
The day that they took the Ghana one, they took they sent the Ghana one. They called one minister, Elizabeth Ohene.
Yes.
And then they were asking her, because one of the doctors from America, he was saying that Ghana is not the country that they need the vaccine, because they had small death rates, and then most of them were able to recover. So the journalist was asking her, what were they doing? I think that was the time that they have to sell themselves, because they were using something there. That's why they were able to boost the system, and the death rate was low.
Right.
But the answer was just because if you don't have the vaccine, you can't travel.
Well, it's one of them.
If the immune system can be boosted, and then it's the same way. So they should think about those kind of things too. And then they are saying that after reopening the lockdown,
yes,
we are expecting for the third lockdown,
right?
The third wave.
Yeah.
So if we have taken the vaccine, and then we just lift up the lockdown and then another third wave, then it means the vaccine is not effective.
All right. Now, it is effective in the sense that already with vaccination, and America is showing they're taking the lead, although, as I say, 532,000 people as of yesterday have died, which is a massive figure. 532,000 have died in America. Here is about 125,000. Now I did start by saying the body has its own way of fighting infection or fighting anything. Like a cat, you heal without even going to hospital. And please let me make this statement about Ghana. The thing with Ghana, and I'm so pleased that the vaccine is there, is that our health service system lacks a lot of things. And there are so many people in Ghana who have died from lack of oxygen. Simple. Yeah. And when nurses are doing measurements on you and they talk of oxygen saturation, this and that, and a lot of people can die in Ghana where they go to the hospital and there is no oxygen and people die. So if there is any place where I'm going to advise have the vaccine, it will be a place like that, because so many people are walking around at funerals. I mean, today I was watching a funeral in Ghana. They had already said this number of people are the ones to be allowed at funerals. But in Ghana, a relative has died. You know how we attend funerals. You're not going to stop the family members. You're not going to stop people. They wear masks. I saw them wearing masks, but you couldn't stop them. And so many people were there. But we are lucky, as I say, the death rate is low. We are lucky that the death rate is low. But the reason why we have to protect ourselves is that our health service is not to the same standard as you can get in Europe here, or the United States, or Australia, New Zealand, or South Africa. That you have to protect yourself, please. So tell your relatives to protect themselves. I mean, I've heard all sorts of stories about a type of immunity, but if you look at it, these are some individual stories. They're not stories based on science, in that you've assessed maybe 1,000 or 4,000 people and you can make that statement. But now, science has become so important. If you make a statement, it has to be evidence-based. It has to be evidence, because ad hoc statements are there. You can say it because somebody did this, nothing happened. And then, oh, so many people, what about the fishermen? What about this? But don't forget that once a disease gets in there and starts spreading, you heard of so many people have died. And in fact, I know of quite a number of Ghanaians who have died in this country, and people who have died in Ghana as well. But in Ghana, are you going to have these death certificates from all the rural areas about cause of death? Are you? I don't think that's the case. Yeah. So it's important, please. Yeah. Okay.
I believe we have a question from, is it AL? I don't know who it is, but it says AL.
My question is that
Yeah.
when you meet with somebody and then you don't know if they have the virus, and then they pass it to you, but you don't even know, and you take the vaccine, will it work or not?
Well, this is why we are advising you to take the vaccine.
Thank you, Papa.
Thank you.
Okay, I believe we have a question from the Nomafo family.
Erade Asumdi Enkamo. Papa, can I please ask my question in P?
Yes, certainly.
Oh, thank God. Yo, Papa Mpacho, I'm semi late. I can't see me. Him send me question. I may be sano. Why explain it that nowadays at 7? Yo, near a decline. Me pese me who said so being a COVID na onim. Now call Paniana a day a day and a day no. Ye decline no near Tosumi no so. A day in Tina. Mawa COVID Paniana still na messing COVID. I say me na this time around na ebekume and I say enkume. Na near Tosumi and Sanon so near a Christopher ye na worried and they say panye and ye kwaku. I didn't see a Christopher be linked this panye to 666 Na yeah because I didn't know panny na this particular panny any day. I say ye be my certificate. And I say ye be my passport. And no near the be ya how no a daintina. Sa adeno beba so say I didn't radio ma passport. Na say obia onyem ene na wa panny ni bi. Na we sa passport na into a bend the beto me say me to kwaya. That's all my questions no.
Yo, Pacho, my main passport dear no. Unse already no. I'm say na uni ha na me can say. Me ba chrome ha no. Na meduma me ye no na ne mikosua wo New Zealand no. My first specialty no na community medicine ne child health ne ade. Nti na immunization ye me specialty. Na se uwo injection bia unsa akoda bia ye mouth certificate ye mouth we bia especially mama for measles in your example because measles near one or twice someone him say ye wo measles no and also second dose to send ya COVID here ni nyina ye mouth in fact it do baby especially health service say uko ye adwuma ana say uko university kra wo America say ya you catch yourself vaccination certificate brand no monhwe one person who say why ye ni nyina say tetanus numni whooping cough measles ni ni nyina yemo even yellow fever kra kan no say o ko Ghana o traveler ko Ghana as I say we show yellow fever certificate enti enye first time ye de sa abano so ndi mpacho pi eno de wo hodada na adia ebia nipa ntam mother say bia wako flu vaccine wo flu vaccine no wo GP no wo record nti say o kan say oh wo hia record ye ka say o koye adwuma ba bi na fa record ye betimi am certificate ye printed them out nti vaccine bia ye ma bia na wo certificate TB ni ade say who say we o Ghana ye wo fofra na de awo enti ni ade smallpox ayi ani etiti hanom ni ade ni nyina certificate won ni nyina certificate won bachawara won ni bachaw kasa o pesa o kan bibi
Patcho David.
Nia me can say say idea ba kwa me kan me say what will be for example me my example be say chicken pox say chicken pox a virus na deba so unya chicken pox term bia no a very rare so we full blown second chicken pox na mum ube to be in contact to be when you chicken pox when you be dada when you kakra utiminya shingles someone names shingles no and I can say a call round and the one here nekushia ube uni ade na sports na womuka if you say the same virus na mo immunity already until we full blown one na unya bibi similar but enya dia ebekumu I'm say beginning no me refi bibi aka bi na me treachery mo
Ade me busa first no.
say no crab make me my answer no but o de enya hwe o kai asambra bi why yo I'm so be a pejanensa na yenhu ni pa ko obi ape
me pacho onu na ebisa
question say yo
Mr. Reynolds Dana. Okay. Senyor Nadia.
Debbie.
Okay. Yeah. And it was
pacho me go question me person me bisa
Doctors.
You will be more comorbidities. Is there any information via Mwenya say or vaccine na inya adverse effects be almost so and
say one more be a one more underlying conditions near there.
Condition say be a diabetes,
Well,
high pressure, maybe a medications be a be more for depression, anxiety and
well, me just say enuntina say uko obewa yi bisa routinely say oh a drobiswa. And they mainly to find out say a beer manufacturers need the information be a brain say be was a particular drug you're careful you miss more information because say we run a few tests near new GP rates and least and sign what they are. Now especially me say normal Nintia sa nkrofo what pre-existing conditions no ye ma as priority ni say when we say diabetes what complications be pre and feel say one more na no one more vulnerable in the sense that as I see a boost one immune system no intem no one to withstand bibisa because already diabetic no we are vulnerable. We bet me so many other conditions, comorbidities, cardiac. And now we prioritize microphone and now one more heart and lung conditions, especially in asthma, and now say long-standing chest conditions, heart disease. Normally, the woman now will prioritize one pa and your warm, and if homes, no one with dementia, apart from old age, then say you making sure say woman benyabi because as conditions need be a weaken immune system. No diabetes say a count. Only I see amount near the boost immune system. Non tem. Na abua pama ni pepi feel safe. Just also one my confident. Homes in nursing homes near there. That's a nanka a baby brain. Who said Nancy over to know a coffin a coffin. Until front line for no who said nurses and doctors no Yama woman in our and I one more year care homes and also Yama monso our well na a good say a bayesa naturally say it me boost one immune system no nothing. The tendency to get the infection and spread it, and also abafema ne niwa. Ebe bua sang microphone so no more live when they get it. And I say base umunya cry to be so mild saying yes, we call hospital and I did doctor cry. No.
I mean that's with the follow-up questions I'm the same
business. You
Pacho say when you're COVID pain
you
now I recover from it full blown. What to me sign ya COVID bioma?
Well, no, not say no so say vaccine was starting, and I yarena kasa eba no say di be 1 year or I'm say China cradi dia na abrokakra but be 1 year. Na enuna sa question no ne we be say a very good question pa but absolute answer ni nyamai nienti nyamai no say look at flu obi okra owo flu vaccine no kra obo say na when symptoms no kra be and if flu no ye bia o sha yewo because and I make say virus the woman who optimism ne was it Mrs. behavior na very very easily and this one you follow on a bia say empire ye born say e bia one shot no ebetimi my immunization senior itimi my immunization against measles wa na wa 2 shots win him say oh and you likely so ubenya kura so mild and bibia bemawaya. Yo.
Yo. Obi a type question about bisa say adentin cure first but vaccine and aba. Why did that? They didn't find medicine to cure first instead of vaccine.
Yo. Beginning no me can say bacteria there because you were antibiotics. Ye research to me by antibiotics you different types. Yet me for bacteria no so grown or test tube. Now you say you say so bacteria no is sensitive to antibiotic beer. You did better test antibiotic no better test directly. You come no I say a cure. But virus no test virus no test bacteria. And yes, virus to say bacteria. Or the mamma example. Who say gono who sebi may call sexually transmitted disease to say gonorrhea. Because a bacterial infection into antibiotics are ultimately cure. So to say. But HIV are a core into AIDS and now say acquired immune deficiency syndrome. No, sir, you know, big a different virus. You need the equivalent cure to say your antibiotics. You need cure bacteria. And you know, near what say will try to boost your immune system. No, but when you HIV AIDS now. Just a shoot down with immune system, the body's ability to fight it. Oh, and you won't say normal woman in us, normal friend antiretroviral drugs, you know, just to make sure say we immune system now is so damaged, you know, it be boost, you know, from time to time. But who say I'm so for Renos, a man in Sassuache.
Yeah. Papa child and Kayabane Sui and Numbia.
Yo, and Tintisana at your why, Pacho.
Okay. Pacho question.
Yo, also.
Good evening, Pacho.
Good evening.
Pacho, the question is possible say obi inya virus or not, but obi to me tested positive for antibodies.
Yo, and yo, Pacho. So unya virus no cradia. Unlikely so be test positive for COVID no. So unya be cradia. I don't just say nkrofo wo ho a wonam ho a won show symptoms bia and so what me test positive because ebia no aba in contact with obi now so na bia dipa kono won say ebia o mask bi ana say social distance and between uni onipa kono na war nti ebia droplets na ntimi am closer to you but say we are negative completely. What test we are negative? Uma ubia who say not the likely thing is say we keep to protocols, no mask, social distancing, washing your hands, keeping infection control. We are nipa pi namwa wonye bie. Why? Until ASA now we test over test negative.
Yeah, thank you.
Pacho, your referee Justine. Question from Justine. Justina. Yeah, Justine Owusu.
So the Pacho, what do you mean? So, they were advised to transfer me. But my son, papa, a corner and creamy. Good, a nanya. What can you now? So no. The same ma ubi a tell say, mubia any netini. Because me, my will be made a drusu, if we made a drusu. My will be almost based on 1 month. Now, the way a nuclear program would take say after best 1 week in there, ubenya and normal be brewum. After that, you know, wa una mo what say was it a woman grano, the okay. Modin when you're modern graph for. And so all the time I'm some other I go a book Ghana now almost and now she said a BC you be here. Mama will be by me, say woman second time. A drona or more ewono. To be frank, a chini GBA no. Me yare me the drugs and so umumia. Say me yare and I'm modin me work me wono. A chance and na no. In the manufacture, the man say, you know, soon in tea near your papa camo. Now you follow na problem be no. I have my name Mugano. I say, you see, you more problem first than I want. Sanity, I have more thing for well, no more won't say, when you're one thing. I'll be being to me into you may tea your papa a cano, name for I'm pursuing any and putting for one. And yes, this is an NFE. A bamboo be a wangatano, where the Unyama wagatano, Unipeduano. Mama testament who near me to many womb. It says a 90 papana, ye or cancer.
Yo, we're just in the that's papa.
Partial question from Galaxy A50.
Yo, Papa, my question is,
yes,
we've had a lot of discussions going forward regarding some employers consider whether or not, if maybe someone hasn't taken the vaccine, then maybe they will not take them on in employment, or they only take people who have, can certify that they've had the vaccine. Now, I know you're speaking from a medical point of view, but legal point of view, can they do that?
Well,
and then the second part of the question is, I know you've talked about even if you've had the vaccine, and make sure you still continue to observe social distancing and what have you. But in terms of the enclosed spaces, can your employer say maybe still it might be best for you to stay away from the office?
Okay. Well, very, very good question. In this country, and I think it's the same across Europe and in America, there is no absolute compulsion in taking the exam, so in taking the vaccine. Now, having said that, certain places like, let's say, a nursing home, if you are going to work in a nursing home where there are a lot of vulnerable elderly people, or in a private hospital, although the law does not make the vaccine compulsory at the moment, it is not compulsory to take the vaccine. The employer can advise you to take it, because if you are going to look after vulnerable people who may be exposed to COVID from you as the carer, then it means you must think again, consider your own circumstances, because why should you come from outside and give an infection to people that you are supposed to protect and look after? But in law, as the law stands, it is not compulsory. But nobody has also said that an employer who feels that by not vaccinating, you are going to put his or her maybe patients or carers, patients or people who need care, at risk, cannot stop you from working there. Because all they will do is that they have their criteria when you attend an interview. And they will interview you and they will tell you, well, we've got 10 people, 10 candidates. If they don't take you, you're not going to take them to court for not selecting you, because they won't tell you that they rejected you because you didn't have the COVID vaccination. Yeah, because interviews are supposed to be confidential. And this is what happens. But I think Qantas Airline, I think they were the first to say that in order to board the flights, you should have, you should show that you've been vaccinated. You've been vaccinated. That is Qantas Airline, because before it was to show that you have a negative COVID test. But I think Australia, they have virtually getting towards zero, zero infections, and they don't want it spoiled. So that's why they are insisting now that to board their flights, they want to make sure that you are vaccinated. Yeah. Did that make it? So although the law does not make it compulsory, the employer has a choice, because there has been no law to say that if you are going to look after somebody in a care home and you've decided you don't want to take the vaccination, that you should be taken. No, I think so far we haven't had a test case in the courts yet, but I think an employer will have that right to say, look, if you want to come and work with my patients or my clients in a care home, I want you to have the vaccine. And in fact, the government has made it available for all frontline staff to get the vaccine.
Okay, yeah. Thank you.
Okay.
Thank you. I believe because of our time, we will take one or two more questions. Yeah. Then we will bring it to a close. Normal for family.
Papa Mpacho, my question, I feel no makai.
Yo.
Mpacho, me busai say obiko one vaccine na or COVID na onim na so ko wa e den na tu ni pado.
No. Me just say nipa pi na mwa womunim and I say wait me a test negative and but 2 days later no wait me a test positive. Wait me a test positive, and it has happened. It happens all the time. And now the fact that we're testing negative neno maybe we vaccinate 3-4 days time. I no interest in between wait to mean contract, but wait me a contract COVID now who need symptoms. Until the end and one say who says who cause Ruby Crow Hospital. Please be as we take temperature, yes, just as an idea. So I will be a bit me a COVID, but nothing will happen because so who names are there no when you walk over vaccine and one no who needs symptoms are one who a beer immune system no started a year, but a need the capacity a bit me a protect will completely. And until the can say one more NF is one the first vaccine and second vaccine now, because second vaccine is to boost your immunity to the maximum. Why? Dina answer no.
Papa Mpacho, last question. Obi bisa say Africa, say Ghana, mosquitoes transfer malaria through mojani are there from person to person. No, to me, a transfer COVID
yo malaria ne transfer no a different cry. Just say mosquito no ebe sack blood malaria parasites in the womb. And or they are called another person, or they call another person. It is a mode of transmission very different from droplet na mekano. Droplet there, so wukasa, wunwensi, ubowa, wosre, utujum, na droplets tiny in a few mobile. And we know so a idea a respiratory system no. In the mode of transmission no different from malaria, right? Different. And the malaria the ubetimi anya malaria no ena enya no so ne bedi terms ubenya COVID na because transmission no different, right? Malaria they blood to blood.
I believe there are no more hands raised. And our time is up. So, Papa, if there is anything that you want to add to summarize everything, I believe that is the end of our question session.
Okay, right. First of all, I would like to thank the Midlands District and Wolverhampton and Osofu Gifty. As I say, I always call her Osofu Gifty, for giving me this opportunity to interact with you. We are Christians and we pray for each other, and it's important for us to pray for each other to make sure that at the end of this pandemic, we will get all members of our congregations back into church. What I will say is, please, it is important to make sure that when people go around with stories, you tell them that it's better to have some evidence-based scientific information, because the vaccine is safe. It has been shown to be safe so far. There are minor ailments which can happen with any medication. It can happen with any medication. But this is a virus which can kill. And please, let's encourage all our members and our relatives at home in Ghana to take the vaccine. And if you show any side effects that you are unsure of, you can phone the GP. And most of the time, as I say, fever or minor aches and pains, take some paracetamol. You'll find that you'll be all right in no time at all. But please, we all want to stay alive. We pray to God for some answer. We've had the vaccine, and it's important that we encourage each other to take it and pray for each other. Thank you very much for giving me the opportunity. God bless you all.
God bless you. Thank you. What do we say to Papa? What do we all have to say?
God bless you.
God bless you.
Very much. God bless you.
Thank you. Thank you. Thanks. Oh, me, Monsasa, Yamishra, Yina. Ni baby, I ever count here who know be a number 100%.
Amen.
Amen. Amen.
Yo, and then bye-bye.
Bye. All the best.
Oh,
Papa, also for Bompire, my answer, the Apona.
Yes.
Okay, we will call our sister Letitia Ofosuknedu to give us the vote of thanks.
You will be seeing for Yada and the day what he has done for us, because we have learned a lot from Papa. Papa, I mean, sure.
Amen.
No more. I'm holding a bribia which need the Baba Cheshire say, any dampening phones was say, say, or more, it's me organize a mass program which me bass, because there were some questions that we were argument, but and Dodwana Papa to me and Samai. Jacassin, I mean, sure, and that will be beer which me by lines or so. I say, I mean, sure, the much be Nyankopɔn ɛnhyɛ mo anan mu. Amen.
Amen.
Okay. So, Mama, we'll hand over to you so that you can give us a closing prayer and benediction.
Yada Awurade ase. Menim say yɛkasa yɛma ho anka yɛbɛkɔ so because eniama no question dey bebree. Wan hwɛ kra ka yɛbɛbɔ awura hu manka me kra meba so. There was one meeting be a me call here and people ask about Mama, yes, I don't hear say na there. Now I need that to answer. But my guidance, in fact, they shouldn't go more to the spirit because your spirit now will just deviate from the topic now you're discussing. It's and then yes, you to be an yate and it's then I'm yes, you have a bumper, yes, I'm really amenity. Now your best stress send a young yate no young shen in this was I did about quite well and today when it as well where I say, you say, Christo, ni moja na, why are you for thrown into the yet as him a radding and into your media. And it's in me say near better was as to be idea. In me say any other radiso. Now, okay, ya hu idea in send it be an bonny be obeying every and when moment you cry a GD, Munian summer radi ye. As I said, now some very simple and a yabaqua, and me say you were and that's so. I were riding chair, your quiet quaquina, and papa, and to concern a cry GD. Hunemu so no bomodi ase nia nimdia nyame ede ma ye na de fa hunemu e fa ye papa no mo te se papa doctor ene so ene ne yetin mo bomodi ase ye bedi so na hunemu afom so ye beye nya aka nyina de ye onyame dia ono na obehwe ye so na waje ye emra eti se COVID-19 yare boni ehu erade obehwe ye nya kuma ye eto ye hu se onyame obehwe ne waka afa hu bia no obehwe ne wanu onyame ate and it's a kuma to yam fajide ko wapane no obani ayaka no no madro no mojaniti uhu afi amen bam cho mama yambo empire already yanyankopon ya da wase wodo yenti dani dan nyina no wo hye ye gidie den wonam saa kwan so am ye hu sese yeti ase a na already ye wodia anu tina na numere so waboa ye ho ano awo na ase na wafa wakoa awurade doctor mu enede na wada utrim kwadi afa nimbia so asetem akire yen pa ye ne se awurade ye ananka ehu ahye yen so ye ananka esuro bi awurade ahye yen so awurade ye ananka tumi bi afa yare ye ti na di owuompu ato ya adwene mu eno yesu dim ye twam esane se awurade ye nya rehyiamu se awurade wo bagye yen emfa ne ekoso bi awurade wo behwe wo maso na ye nwu na erade ye be te say Israel for ne say erade okuna tumi etwa aya no omuka no so no ba ko anyira wom erade ye ne efie de ye betena ase erade ye benya nkwa na ye nwu ye betena ase na erade akawa ma erade wa mani ye akira amansa erade ne wahye wo ya brabo so ebebe mu anu tu kan ye ho wade anyina mu na nkosoma ansi ye ne ye ni awie peye ene dan so ye hye wo sanse ye nim ye ho so hwe odafo anumere dom na kan ye ho na boy ye ho ba ye kwa akwade ye honhom ye kra ne ye nipa bia ye wodi eti awurade be ye foforo kra biem na wodom ye ma ye hu odreche pa anopa ne ye ka se ampa wote ase na wo na wadom ye ye da wasese machi betwem asomdwe mama ye ne abusuafo wa Ghana ene ba bibiara obi a wo bia wo behwe ye nyina ye so afie ye nyina betwem na awurade ye de aseda ama wa awurade wa tumi nyina ye wodi a wonsam ena ye wo awo Yesu Kristo wodoba didim efa abusuafo mama ye ngi enhira onyame di hira ne manfo ono so kan wo kosi wiase awie ye no owura Yesu Kristo oti asro se na me nyame ameti as I am the God of the living sa nyame kuri on show so sa nyame kuri on show hu kra no nipa bia so boni bi anto na on fa unsie ne nipa mu na oyi won hire ehye ono nyankopon agya oba ene hu konkra ne onyam adom ne nti amen abusuafo nyame enhira mo a monka ye mo amofim ya bebre na ka se ye nya ajepa ya bon pass program say ye ba hu mu nyina wo line so say na ye do odo abodo mu na ye de anije ene esere ache ne pa bia nyame e ba hihya ma ye mra ti say mu awade hira mo mo be kan ho nyame nka mu nyina amkefo a mo ba ye nuncho ajo me wakanya yirado omo e kan nyina no. God bless you very, very much. And Papa, once again, God bless you. We are so privileged and honored. I was out for mommy and fast day and koda. Nyame adom ochina obi bia wo ye nyame ba no kwa sori wate nakobo nyame mpa ye nakobo na fore fa nko kire Yesu nakogi ne nsam hia ne ne pa Awurade emfa mo nko asomdwe mu mune yo ene na mo ma ye nchira papa baba ya se
bye yo
ene mune yo
bye
bye.
Come and see the Lord. There is nothing He cannot do. Come and see the Lord. Sing it, come and see. Come and see the Lord is good. Come and see. There is nothing He cannot do. Come and see the Lord is good. Sing it, come and see. Come and see the Lord is good.
You're the one who woke me up this morning. You could do it over again. You give me strength so I can make it through the day. When I'm weak, you call me strong. When I am poor, you say I'm rich. I am amazed at how you do it, but I believe. You're the one who woke me up this morning. You could do it over again. I am alive because your hand is still at work. When I'm weak, you call me strong. When I am poor, you say I'm rich. I am amazed at how you do it, but I believe.